Hello my dear friends, this is Dr. Swapn and you're watching my YouTube channel Dental Expertise, where we explore dental MCQs for all dental competitive exams. Before we start, I request you all to please like and subscribe my channel and share with your colleagues and keep motivate me. Now let's start with question number 41. Ester type local anesthetics are metabolized in. Options are liver, plasma, lungs or kidney. And the correct answer is plasma. Okay, Ester type local anesthetics are metabolized in plasma. Which antibiotic is not only effective against most staphylococci, aerobic and anaerobic streptococci, but it is most effective in treating infection due to bacterioid species? Options are penicillin VK, erythromycin, clindamycin or cephalexin. And the correct answer is clindamycin. Clindamycin antibiotic is not only effective against most staphylococci, aerobic and anaerobic streptococci, but it is most effective in treating infection due to bacterioid species. For dry heat sterilization at a temperature of 160 degrees centigrade, how long does it take to sterilize instrument? Options are 5 minutes, 20 minutes, 40 minutes or 120 minutes. In dry heat sterilization at a temperature of 160 degrees centigrade, it takes 120 minutes to sterilize instrument. Which type of pathogen provide the ultimate test for efficacy of sterilizations? Options are bacteria, spore forming virus or fungi. Spore forming pathogens provide the ultimate test for the efficacy of sterilization. Okay, spore forming pathogens. Next question is, the proportion of existing case of disease in population at one point in time or during a specified period of a time is termed as. Options are incidence, epidemiology, prevalence or frequency. And the correct answer is prevalence. The proportion of existing case of disease in a population at a point in time or during a specified period of time is termed as prevalence. Accurate design to scale and root plan anterior teeth with deep pockets will have. Options are short straight shank, short angled shank, long angled shank or the long straight shank. And the correct answer is long straight shank. Accurate design to scale and root plan anterior teeth with deep pockets will have long straight shank. Placer's concept is associated with. Options are balanced occlusion, organic occlusion, lingualized occlusion or articulation concept. And the correct answer is balanced occlusion. Placer concept is associated with the balanced occlusion. Discrepancies in occlusion of denture may be clearly detected from. Options are observation at denture insertion phase, masticatory efficiency, clicking sound at the temporomandibular joint, remounting procedure of denture. And the correct answer is remounting procedure of denture. Discrepancies in occlusal of denture can be clearly detected from remounting procedure of denture. Next question is, squint test is used as a guide for selecting. Options are shade of the teeth, shape of the teeth, length of the teeth, tooth proportion. And the correct answer is shade of the teeth. And the correct answer is shade of the teeth. Squint test is used as a guide for selecting shade of the teeth. A functional cusp bevel in the preparation of a tooth for full crown or fixed partial denture retainer provide for. Options are improving retention, improving stability, better aesthetics or bulk for restoration for strength. And the correct answer is improving retention. Okay. Functional cusp bevel in the preparation of a tooth for full crown or fixed partial denture retainer provide for improving retention. Color temperature of light source for shade selection process should be. Options are 45K, 55K, 65K, 75K. And the correct answer is 55K. Color temperature of light source for shade selection process should be 55K. Post cementation or luting, pain on biting is most likely due to occlusal overloaded, sensitive to cement, periapical abscess और short margin. तो पोस्ट सीमेंटेशन एंड ल्यूटिंग पेन कब होता है बाइटिंग के टाइम पे? वो क्यों होता है? बिकॉज ऑफ ऑक्लूजल ओवरलोड. ओके. बेस मेटल कास्टिंग अलॉयज are compared to noble metal casting alloys for cast restoration. Options are base metal alloy are softer to finish, base metal alloy are less dense, base metal alloy are more easily hardened, or base metal alloy are more resistant to corrosion. And the correct answer is base metal alloy are more resistant to corrosion as compared to noble metal casting alloy. Okay. Next question is, which of the following is not a radiographic sign for trauma from occlusion? Options are hypercementosis, root resorption, periodontal pocket, or widening of the periodontal ligament space. And the correct answer is root resorption. Root resorption is not a radiographic sign of trauma from occlusion. The ideal time period from placing the indirect pulp cap until a reopening the tooth to remove the remaining decay is. Options are 3 to 4 months, 7 to 10 days, 2 to 3 weeks, or 1 year. And the correct answer is 2 to 3 weeks. Ideal time period क्या होगा indirect pulp cap के placing के लिए? 2 to 3 weeks until the reopening of the tooth to remove the remaining decay. Okay. Next question is, pulpal pain either spontaneous or elicited by an irritant that lingers for more than 10 to 15 seconds. It suggests options are pulpal necrosis, irreversible pulpitis, pulpal hyperemia, or apical periodontitis. And the correct answer is irreversible pulpitis. Pulpal pain either spontaneous or elicited by an irritant. It lingers for more than 10 to 15 seconds. It is called as irreversible pulpitis because reversible pulpitis में 10 to 15 seconds के अंदर ही अगर irritant आपने remove कर दिया तो पेन जो है वो subside हो जाएगा. ओके. बट irreversible pulpitis में ये जो पेन है वो 10 to 15 seconds के बाद भी irritant remove करने के बाद भी नहीं subside होगा. The most effective and most tolerable topical fluoride is. Options are 0.2% sodium fluoride, acidulated phosphate fluoride, stannous fluoride, or 2% sodium fluoride. And the correct answer is 2% sodium fluoride is the most effective and most tolerable topical fluoride. Which is the principal hormone for calcium regulation? Options are calcitonin, parathyroid hormone, thyroxine, or vasopressin, or ADH. And the correct answer is parathyroid hormone. Parathyroid hormone is the principal hormone for the calcium regulation. Intrinsic factor essential for the absorption of vitamin B12 in ileum is secreted by. Options are chief cells, parietal cells, gastric cells, or mucous cells. And the correct answer is parietal cells. Okay. Intrinsic factor essential for the absorption of vitamin B12 in ileum is secreted by the parietal cell. Which of the following enzyme is responsible for dissolving blood clots? Options are prothrombin, thrombin, fibrinogen, or plasmin. And the correct answer is plasmin. Plasmin enzyme is responsible for dissolving the blood clots. Okay. Next question is, pernicious anemia is caused by malabsorption of vitamin A, vitamin C, vitamin B12, or vitamin E. And the correct answer is vitamin B12. Pernicious anemia is caused by the malabsorption of vitamin B12. Which of the following is not the prominent toxic effect of mercury? Xerostomia, irritability, loosened teeth, or tremors? And the correct answer is xerostomia. Xerostomia is not the prominent toxic effect of mercury. Okay, because xerostomia means dry mouth and it does not have the toxic effect. Okay. Immediate denture should be preferably relined after 1 month and 3 month post extraction, 4 month and 7 month post extraction, 5 month and 10 month post extraction, or 1 year and 2 year post extraction. And the correct answer is 4 month, 7 month post extraction. Immediate denture should be preferably relined after 4 month and 7 month post extraction. Okay. The incisal edge of maxillary teeth should touch the wet or dry line of the lower lip while creating TH sound, F and V sound, P and V sounds, and S sound. And the correct answer is F and V sound. Okay. The incisal edge of maxillary teeth should touch the wet or dry line of the lower lip while creating F and V sound. Okay. Next question is posterior palatal seal for maxillary denture. Posterior palatal seal for maxillary denture. Options are is placed 3 mm posterior to vibrating line. It is not necessary when fabricating a complete denture on a patient with flat palate. It is not necessary if a metal base is used, or it will vary in the outline and depth according to the palatal form of the patient. And the correct answer is it will vary in the outline and depth according to the palatal form of the patient. Okay. A reverse 3/4 crown is most frequent fabricated for. Options are maxillary molar, mandibular molar, mandibular premolar, or maxillary premolar. And the correct answer is mandibular molar. A reverse 3/4 crown is most frequently fabricated for mandibular molar. Okay. Next question is strain hardening or work hardening are best described as. Options are hardening or deformation of a metal at room temperature, hardening of a metal at a very high temperature, softening of metal by controlling heating and cooling, softening a metal at room temperature. And the correct answer is hardening of a metal at a room temperature. Straight hardening or work hardening. It means hardening of a metal at room temperature. Burkitt's lymphoma is associated with. Options are herpes virus, Epstein-Barr virus, cytomegalovirus, human papilloma virus. And the correct answer is Epstein-Barr virus. Burkitt's lymphoma is associated with Epstein-Barr virus. The most common neoplasm in AIDS seen in AIDS patient is non-Hodgkin's lymphoma, squamous cell carcinoma, basal cell carcinoma, or Kaposi's sarcoma. And the correct answer is Kaposi's sarcoma is the most common neoplasm seen in AIDS patient. And the second one is non-Hodgkin's lymphoma. ये भी आपको एग्जाम में आ सकता है, तो आप ये भी याद रखेंगे. फर्स्ट कौन सा कॉमन है? कपोसी सार्कोमा. अगर कपोसी सार्कोमा ऑप्शन में नहीं होगा तो आप नॉन हॉजकिंस लिम्फोमा भी टिक कर सकते हैं. The prime factor that initiate myofascial pain dysfunction syndrome. Trauma, muscle spasm, periodontal disease, or tumor. And the correct answer is tumor. The prime factor that initiate myofascial pain dysfunction syndrome is trauma. Okay. तो ये था आज का वीडियो हम यही एंड करते हैं. अगर आप इसका एक्सप्लेनेशन देखना चाहते हैं तो उसका लिंक मैं डिस्क्रिप्शन बॉक्स में आपको दे दूँगी. थैंक्स फॉर वॉचिंग.